याचिका में जमाकर्ताओं ने बिना किसी शर्त उन्हें चिकित्सा आपातकाल के मद्देनजर तत्काल 5 लाख रुपए तक निकालने की अनुमति देने की मांग की है। इस घोटाले के सामने आने के बाद कई जमाकर्ताओं द्वारा आत्महत्या करने का मामला भी सामने आया है। सीबीआई ने राजस्थान के मुख्यमंत्री अशोक गहलोत के ओएसडी देवाराम सैनी से एसएचओ विष्णुदत्त बिश्नोई आत्महत्या मामले में पूछताछ की। जयपुर में देवाराम सैनी से सीबीआई की ये पूछताछ करीब 2 घंटे तक चली। सोमवार को इसी मामले में सीबीआई ने कांग्रेस विधायक और ओलंपिक पदक विजेता कृष्णा पुनिया से भी पूछताछ की थी। एसएचओ विष्णुदत्त चूरू जिले के राजगढ़ थाने में तैनात थे। 23 मई को उनका शव उनके आवास से बरामद हुआ था। उन्होंने एक नोट में एक मामले की जांच में राजनीतिक दबाव डाले जाने का जिक्र किया था। केरल में सामने आए सोना तस्करी मामले में एनआईए की विशेष अदालत ने मुख्य आरोपी स्वप्ना सुरेश और संदीप नायर की हिरासत 24 जुलाई तक बढ़ा दी है। इस बीच एनआईए ने मामले में एक और आरोपी सरित को हिरासत में लेकर तिरुवनंतपुरम सहित अन्य जगहों पर ले जाकर जांच की है। सीमा शुल्क विभाग ने 5 जुलाई को करीब 15 करोड़ की कीमत वाले 30 किलोग्राम सोने की तस्करी का पर्दाफाश किया था। ये सोना राजनयिक चैनल का इस्तेमाल कर लाया जा रहा था। राजा मानसिंह हत्याकांड में 11 लोग दोषी करार दिए गए हैं। सजा पर फैसला बुधवार को सुनाया जाएगा। राजस्थान के बहुचर्चित और भरतपुर रियासत के राजा मानसिंह हत्याकांड में 3 आरोपियों को बरी कर दिया गया है। 35 साल पुराने इस मुकदमे की सुनवाई के लिए राजा मानसिंह की बेटी दीपा सिंह, उनके पति विजय सिंह मथुरा कोर्ट पहुंचे थे। 21 फरवरी 1985 को भरतपुर के राजा मानसिंह व 2 अन्य की डीग थाना क्षेत्र की पुलिस ने मुठभेड़ कर हत्या कर दी थी। मामले में सीबीआई ने जाँच की थी और सुप्रीम कोर्ट के आदेश पर साल 1990 से मथुरा कोर्ट में सुनवाई चल रही थी।
रूस ने इस बात से साफ इनकार किया है कि वो दूसरे देशों के चुनावों में दखल अंदाजी करता है। रूस की ओर से ये बात उस ब्रिटिश संसदीय खुफिया और सुरक्षा समिति की लीक हुई रिपोर्ट के बाद आई है, जिसमें रूस के बारे में कहा गया है कि साल 2014 में स्कॉटलैंड स्वतंत्रता जनमत संग्रह अभियान पूरी तरह से रूस से प्रभावित था। सूडान ने मंगलवार को 1989 में सैन्य तख्तापलट का नेतृत्व करने के आरोप में बेदखल राष्ट्रपति उमर अल बशीर और उनके कुछ पूर्व सहयोगियों के खिलाफ एक नया मुकदमा शुरू किया। स्टेट टीवी ने बशीर का फुटेज दिखाए बिना ट्रायल का प्रसारण किया। 3 दशक तक सत्ता में रहे बशीर का पिछले साल तख्तापलट हो गया था, जिसके बाद से वो खरतूम की जेल में है। बशीर के खिलाफ भ्रष्टाचार के अलावा उनके राज्यकाल के दौरान विरोध प्रदर्शन में शामिल लोगों की हत्या के संबंध में भी मुकदमा और जाँच चल रही है। यूक्रेन के पश्चिमी शहर लुत्स्क में मंगलवार को एक व्यक्ति ने एक बस जिसमें 20 लोग सवार थे बंधक बना लिया। पुलिस के मुताबिक बंधक बनाने वाले व्यक्ति ने अपने पास हथियार और विस्फोटक होने की बात कही। हालांकि पुलिस ने इस बारे में कुछ भी नहीं बताया कि बंधक बनाने वाले व्यक्ति की मांग क्या थी। इस संबंध में यूक्रेन के राष्ट्रपति ने कहा कि गोलियों की आवाज सुनी गई और बस को नुकसान हुआ है।
और अब देखते हैं कोविड-19 से जुड़ी कुछ अंतर्राष्ट्रीय महत्वपूर्ण खबरें।
चीन में कोविड-19 की वैक्सीन के दूसरे चरण का प्रयास पूरा किया गया। इसमें वैक्सीन को पूरी तरह से सुरक्षित पाया गया और प्रतिरक्षा प्रणाली पर अच्छी प्रतिक्रिया व्यक्त की गई। मई में प्रकाशित रिपोर्ट से पता चलता है कि दूसरे चरण में पहले चरण के मुकाबले ज्यादा लोगों को शामिल किया गया। वैक्सीन की पहचान के लिए ये चरण काफी महत्वपूर्ण है और तीसरे चरण पर काम चल रहा है। ब्रिटेन के प्रधानमंत्री बोरिस जॉनसन ने अपने मंत्रिमंडल के शीर्ष सहयोगियों के साथ आमने सामने की बैठक में हिस्सा लिया। इस तरह की बैठक 17 मार्च के बाद आयोजित हुई। बैठक के दौरान कोरोना के कारण अर्थव्यवस्था के हुए नुकसान की भरपाई और इसे फिर से पटरी पर लाने को लेकर चर्चा हुई। डाउनिंग स्ट्रीट ऑफिस में सप्ताह के दौरान होने वाली मंत्रिमंडल की बैठक को कोविड-19 के खतरे के नियंत्रण से बाहर निकलने के बाद बंद कर दिया गया था। यूरोपीय संघ के नेता कोरोना वायरस से निपटने के लिए एक विशाल फंड बनाने पर सहमत हुए हैं। इसे कोरोना महामारी से प्रभावित यूरोपीय यूनियन के देशों को बचाने का ऐतिहासिक राहत प्लान बताया जा रहा है। फ्रांस के राष्ट्रपति इमानुएल मैक्रों ने कहा कि यूरोप के लिए ऐतिहासिक बदलाव है। जर्मन चांसलर एंगेला मर्केल ने कहा कि असाधारण हालात असाधारण प्रयासों की मांग करते हैं। सभी यूरोपीय लोगों के लिए इस बेहद कठिन समय में निश्चित रूप से काफी कठिन बातचीत रही। विश्व स्वास्थ्य संगठन के महानिदेशक ने कहा है कि विश्व में लोगों की खुशहाली के लिए राजनीतिक नेताओं को कोविड-19 की वैक्सीन सभी के लिए उपलब्ध कराने के लिए काम करना चाहिए। उन्होंने कहा कि टीका सभी तक पहुंचे, इसके लिए राजनीतिक प्रतिबद्धता जरूरी है। क्रिकेट ऑस्ट्रेलिया ने मंगलवार को कहा कि उसने 2020 विश्व कप के स्थगित होने के बाद दी गई स्पष्टता का स्वागत किया है। क्रिकेट ऑस्ट्रेलिया ने कहा कि 2021 और 22 में ऑस्ट्रेलिया में दोबारा इसे आयोजित कराने को लेकर वो कोई बात नहीं करना चाहते हैं।
इस खबर के साथ फिलहाल न्यूज़ नाइट के इस बुलेटिन में इतना है, लेकिन डीडी न्यूज़ पर खबरों का सफर लगातार जारी रहेगा। नमस्कार।
Hello and welcome. I'm Ramesh Ramachandran and you're watching News Night here on DD India and DD News, your prime time destination for news and bespoke analysis. It's good to have you again with us. On the show tonight, a deep dive into the results of a COVID-19 survey conducted in Delhi. Also on the show, we preview Prime Minister Narendra Modi's address to an India-US business summit on Wednesday, which will focus on cooperation between the two countries in a post-COVID-19 world. Plus, news and updates from around the world, all that and much, much more coming up over the next 60 minutes. But first, as always, the headlines. Prime Minister Narendra Modi to deliver the keynote address virtually at the India Ideas Summit on Wednesday. The summit will discuss about India-US cooperation in a post-COVID-19 world. A serological survey shows that only 23.48% of the Delhi population developed coronavirus antibodies. 77% of Delhi's population is still susceptible to the coronavirus, according to the Health Ministry. The transition rate is lower than the national average in 30 states and union territories. Lockdown and containment prove effective. Over 7.24 lakh people in India recover from the COVID-19 disease. The mortality rate falls further to 2.43%. The The BJP lashes out at Congress leader Rahul Gandhi. Union Minister Prakash Javadekar asks the Congress party to note India's achievements in the war against the coronavirus and stop insulting the corona warriors. The Rajasthan High Court suggests Rajasthan Assembly Speaker to defer action on the disqualification notices given to dissident Congress MLAs till 24 July. Court likely to pass appropriate orders on the writ petition filed by Sachin Pilot and 18 dissident MLAs on the 24th. Heavy rains disrupt normal life. The flood situation remains grim in some states. Union Home Minister Amit Shah speaks to Meghalaya Chief Minister Conrad Sangma on the flood situation in the Garo Hills, assures all assistance from the central government, says the nation stands resolutely with the people of Meghalaya in these trying times. Madhya Pradesh Governor Lalji Tandon's last rites performed with full state honours. The 85-year-old leader breathed his last at the Medanta Hospital in Lucknow. The President, Prime Minister and other leaders offer condolences. The annual Amarnath Yatra cancelled due to the COVID-19 pandemic. Jammu and Kashmir Lieutenant Governor G.C. Murmu takes a decision after chairing a meeting of the Amarnath Shrine Board. And over 1.47 crore COVID-19 cases reported globally. Death toll crosses 6.1 lakh. Over 10,000 cases reported for the 6th consecutive day in the US state of Florida. Crowds gather for a coronavirus test in Los Angeles. Now, first up, we preview Prime Minister Narendra Modi's address to an India-US Business Summit. Now, Prime Minister Modi will address the India Idea Summit on Wednesday. It's being organized by the Washington, D.C.-based US-India Business Council. The summit brings together officials from India and the US for setting a post-COVID-19 agenda of cooperation. Here's the report.
Prime Minister Narendra Modi will deliver the keynote address at the India Idea Summit on Wednesday. The summit is being hosted by the US-India Business Council on its 45th anniversary. The theme for this year's India Idea Summit is Building a Better Future. The summit will witness discussions on areas including India-US cooperation and future of the relation between the two countries in a post-pandemic world. The participants in the summit will discuss a wide range of topics including the impact of coronavirus on global supply chains and healthcare collaboration between the US and India. As Prime Minister Modi navigates the twin challenges of managing the health impact of COVID-19 and the associated global economic disruption, his address will be keenly awaited. The virtual summit will feature a high-level presence from Indian and US government policy makers, state-level officials, and thought leaders from business and society. Other key speakers at the summit include Minister of External Affairs Dr. S. Jaishankar, Finance Minister Nirmala Sitharaman, Commerce Minister Piyush Goyal, US Secretary of State Mike Pompeo, former US Ambassador to the United States Nikki Haley. The summit will also feature senior executives from top US and Indian companies, including CEO of Lockheed Martin, Tim Taiclet, and Chairman of Tata Sons, N. Chandrasekharan. Newsnight Desk, DD India.
Now, Minister for Commerce and Industry Piyush Goyal and Finance Minister Nirmala Sitharaman attended the 2020 India Idea Summit by the US-India Business Council through a video conference. Now, at the summit, the Commerce and Industry Ministry highlighted the friendship shared by India and the US, describing them as natural allies. The minister said that the two countries have helped each other in the times of need, and with a trade agreement, this partnership will only strengthen. He said they need to work together towards a sustainable, robust and enduring partnership. If not a free trade agreement, they can work out a preferential trade agreement with corresponding activities for Indian businesses in the US.
We need to work towards a much more sustainable, a much more robust, a much more enduring partnership in the form of a free trade agreement to which India is willing to work with an open mind, with a willingness to open our hearts and our markets with a corresponding opportunity for Indian businesses in the US. We believe we should also look at an early harvest in the form of a preferential trade agreement so that we can, rather than waiting for the gains of a free trade agreement, which may take several years to conclude, we could look at an early harvest of maybe 50, maybe 100 products and services where we can engage with mutual trust and an open spirit.
And for her part, Finance Minister Nirmala Sitharaman highlighted the structural reforms undertaken by the government during the lockdown to ensure welfare of the people. She highlighted how power consumption has increased, banking sector has been working smoothly, benefits given to farmers such as selling their produce wherever they desire to, whomsoever they want. She emphasized that the government is encouraging the private sector to participate in various domains for better competition.
In India, there is no sector which is reserved for public sector alone to be present. We have announced that we will have a list of strategic sectors, which will be only a select few, and in only them will there be private sectors, public sector remaining. In other words, in every sector, private sector will be, every sector of economic activity, private sector will be invited. The public sector or the public sector undertakings will be present only in certain determined, predetermined, certain announced areas of activities. They will be only up to a maximum of 4 public sector organizations and not more. The private sector is going to be anywhere welcome. So, simply put, there will not be any activity in India which will be the exclusive domain of the public sector undertakings.
And Union Transport Minister Nitin Gadkari also attended the event and spoke on the MSME sector. Let's listen in.
Our MSMEs are doing excellent jobs. They are doing good exports. Their track record is very good. As far as the return on equity, return on investment, the Indian economic situation is really better in the whole world. Our interest cost is high.
All right, let's now dive straight into our cover story. The Union Health Ministry had commissioned a sero-surveillance study in Delhi, the results of which are now available. Now, this survey was conducted by the National Centre for Disease Control in collaboration with the Delhi government. The survey found that only 1 in 4 people in Delhi was infected by the coronavirus. The next report tells you more.
Over the past few months, India has taken a number of steps to break the chain and beat coronavirus. They've shown encouraging results, but India is not out of the woods yet. Vigilance is of the essence. Recently, the Union Health Ministry commissioned a serological survey in the national capital Delhi. This after the city reported a spike in the COVID-19 cases. The National Centre for Disease Control and the Delhi government conducted the survey in all 11 districts of Delhi. The results of the survey are out. It shows the prevalence of a certain antibody that fights against the coronavirus in nearly 1/4 of Delhi's population. That is not all. A large percentage of such people were asymptomatic.
11 में से 8 डिस्ट्रिक्ट दिल्ली में जिनका सीरो प्रेवलेंस बाई 20% से ज़्यादा आया है. इसमें सबसे ज़्यादा जो अगर हम बात करें तो हमारी डिस्ट्रिक्ट आती है सेंट्रल डिस्ट्रिक्ट है, उसके बाद हमारी नॉर्थ ईस्ट डिस्ट्रिक्ट है, नॉर्थ डिस्ट्रिक्ट है और शाहदरा डिस्ट्रिक्ट है. ये हमारे डिस्ट्रिक्ट जो है काफ़ी 27% के आसपास इनमें प्रेवलेंस मिला है. मतलब ये हमको इंगित करते हैं कि यहाँ पर वायरस का एक्सपोजर यहाँ की पॉपुलेशन को एक 27% पॉपुलेशन को ऑलरेडी तकरीबन हो चुका है. तो हमारी दिल्ली की पॉपुलेशन 22.86% थी आज की तारीख में इससे एक्सपोजर हुआ है या संक्रमित हम उसको मान सकते हैं. 77% आबादी हमारी दिल्ली की आज भी वल्नरेबल है.
Less than 24% of Delhi's population was infected by the coronavirus, shows that steps such as lockdown and containment taken to control the spread of the virus have proved effective. This, in spite of the fact that Delhi has many pockets of high population density.
हमारे लॉकडाउन वाले मेजर्स और जो कंटेनमेंट मेजर्स एक एग्रेसिव रूप से लिए गए, जिससे कि शुरुआत से ही हम लोग एक इसको इन्फेक्शन को एक उग्र रूप लेने से रोक पाए, वो एक हमको इसकी सफलता की ओर भी ध्यान दिलाती है.
The survey was conducted between the 27th of June and the 10th of July in all 11 districts of Delhi. More than 21,000 samples were tested. The results of the survey will help to draw up an appropriate strategy to contain the spread of COVID-19 disease in Delhi. Meanwhile, the case fatality rate in the country continues to register a steady downfall. It has dropped to 2.43% as of now. India has one of the lowest case fatality rates in the world. Over 7 lakh persons have been cured of COVID-19 and discharged till now. Medical attention is being provided to all the 4,02,529 active cases in hospitals and home isolation. 28,084 patients have died so far. With Nitendra Singh in Delhi, Newsnight Desk, DD India.
All right, let me break it down for you. No jargon, no complicated words or phrases. Instead, I will use simple language to help you, the viewer, understand the subject matter at hand. Let's start with the basics. What is an antibody? Let's bring up the first graphic for you. What is an antibody? It is a form of protein. It fights off a virus or other germs. Now, the immune system, as I mentioned, fights off a virus or other germs. The immune system produces it in response to an infection. Now, when a body is infected, antibodies are formed in the human body as a response to the infection. That's the third point. And it's specific to a particular infection. Now, every antibody is specific to a particular infection. And that indicates which germ your body has been exposed to before that infection has set in your body. So it's specific to a particular infection, and which germ your body has been exposed to before is also learned from the antibody test. Right, so there you go. It indicates which germ your body has been exposed to before. Now, the second question everybody is asking is, what is immunoglobulin G or IgG? It is a common type of antibody found in the blood in the human body. It develops around 2 weeks after an infection sets in the human body, and it is found in the blood. Then it indicates a COVID-19 has been there present in the body in the recent past, and importantly, it remains in the blood after you have recovered from the COVID-19 disease. Next up is, what is immunoglobulin G antibody test? Now, this test identifies the presence of antibodies in a general population. Remember, it is not a diagnostic test. It is not a diagnostic test. Now, it is different from a swab test. Now, swab test is one thing very common. It tells you currently whether you have a disease or not. Now, this is happening in parts of Delhi as we speak. Now, it tells you whether you currently have a disease or not. That is all. It's not a diagnostic test. Now, the immunoglobulin G antibody test can find out whether you have been infected by a certain kind of virus or not. In other words, it detects antibodies against the virus that causes COVID-19. In other words, it shows whether your body's immune system is okay or not. So that's as I mentioned, it shows whether your body's immune system is healthy or not. Now, an infection causes the body to make too many or too few IgGs. Now, that's very important. Why? Because less IgGs in the blood indicates low immunity or a greater chance of getting the infection. At the same time, more immunoglobulin in the blood could mean either an allergy or an overactive immune system. Right. Next up is a question, what does it not conclusively prove? It does not conclusively prove whether IgG guards against COVID-19 infection a second time. In other words, a second time when the disease sets in, we're not sure. And a positive IgG antibody test does not mean you are immune to COVID-19. That's very, very important. Right, moving on to the other graphic, what is serosurveillance? Now, it's a repeated antibody test conducted over a period of time. Now, the survey identifies presence of antibodies in a given population and the information about past COVID-19 infection in individuals who test positive for the virus, and it generates evidence for assessing the spread of pandemic from time to time. Let's now focus on the Delhi serosurveillance. This was commissioned by the Union Health Ministry, It was carried out by the NCDC, that's the National Center for Disease Control, in collaboration with the Delhi government. And finally, what it does is that it was conducted for 14 days between 27 June and 10th July. And all 11 districts of Delhi were surveyed in this Delhi Sero Surveillance. And the samples collected of the blood samples collected from select individuals, they were chosen after a written informed consent was taken from every individual. And more than 21,000 samples were tested for the immunoglobulin G antibody. And now let's look at the results of the Delhi survey. The IgG antibody found in only 23.48% of the Delhi population. Now, Delhi has many pockets of high population density, and yet we've seen that lockdown, containment, and surveillance have proven to be very effective. But, now this is an important but, a significant proportion of the population is still vulnerable. Why? Because a large number of infected persons were asymptomatic. But containment measures need to continue with the same rigor, and non-pharmacological interventions must be strictly followed, which means keep social distance, avoid crowded places, wear a mask at all times, maintain hand hygiene, and practice cough etiquette. All right, so thus were the graphics. Time for a very short break here. When we come back, we'll have guests over for a discussion in our In Focus segment. Keep watching Newsnight. Don't go anywhere.
मन की बात, माननीय प्रधानमंत्री श्री नरेंद्र मोदी भारत की जनता से साझा करेंगे अपने मन की बात रविवार 26 जुलाई सुबह 11 बजे। आकाशवाणी के सभी केंद्र, सभी चैनल इसे प्रसारित करेंगे एक साथ। इसके अतिरिक्त दूरदर्शन के YouTube चैनल और प्रसार भारती के ऐप न्यूज ऑन एयर पर सजीव प्रसारण लाइव स्ट्रीमिंग के माध्यम से। तो याद रखें, रविवार 26 जुलाई सुबह 11 बजे मन की बात।
हमारी आज की तेजस्विनी एक ऐसी महिला है जिन्होंने पुरुष प्रधान माने जाने वाले क्षेत्र में न केवल कदम रखा बल्कि अपनी क्षमता की धमक भी दर्ज करा। एक व्यवसायी के तौर पर क्या महिला या पुरुष होना कोई मायने रखता है?
जो महिलाएं अगर आगे बढ़ना चाहती है तो उन्होंने अपना खुद का जो स्ट्रेंथ है उसे बढ़ाना चाहिए, ना कि हमारी जो वीकनेसेस है उसके ऊपर फोकस करना चाहिए।
आप खुद अपने आप को किस तरह देखती हैं?
व्हाटएवर आई डू मैं फुल कमिटमेंट के तौर पे देखती हूँ, चाहे वो प्रोफेशनल लाइफ हो, चाहे वो पर्सनल लाइफ हो, चाहे वो फैमिली मैटर्स हो, चाहे माय ओन पर्सनल हेल्थ हो, पूरा कमिटमेंट लेके मैं चलती हूँ।
All right, welcome back. You're watching Newsnight on DD News and DD India. Time now for our In Focus segment, in which we're discussing about Delhi COVID-19 survey and analysis. All right, joining me are Dr. Randeep Guleria and Dr. N. Krishna Reddy. Dr. Guleria is the director of the All India Institute of Medical Sciences, New Delhi. Dr. Reddy is a senior cardiologist and the country director of Access Health International, New Delhi. Dr. Guleria joins us from Delhi and Dr. Reddy from Hyderabad. Gentlemen, welcome to Newsnight. Let me start with you, Dr. Guleria. Help our viewers understand the significance of this serological survey conducted in Delhi and the import of those results for Delhi and the country, the nation at large.
So serosurveillance is done to see what is the prevalence of infection in the community, how many people have been exposed to the infection, because it's not a diagnostic test. It does tell just how many people have had the infection and recovered. And we've talked of the IgG antibodies. It takes about 14 days at least for the IgG antibodies to form in sufficient amount for it to be picked up. Now, what this survey did was it looked at people who did not have COVID infection or were not aware of that they had COVID or been tested for COVID infection, and looked to see how many of them had mild or asymptomatic infection which was not tested but had the exposure and just was picked up by the antibodies. And what it shows was that around 23% of individuals in Delhi, in different zones, out of the population, the sample size that they had surveyed, were positive and had had the infection. What it also meant was that almost 77% of people had not had the infection and were still vulnerable and had been protected by the lockdown and the containment strategies from getting the infection. And thereby, it suggested two things. One, that whatever strategy that was put in place in Delhi was able to prevent the widespread spread of this infection in the community. And secondly, that we need to continue to be vigilant, need to continue with our hand washing, social distancing and masks, and the strategy of isolation, testing and contact tracing, because still a very large number of the population in Delhi is vulnerable, and we need to be careful in terms of not having increasing number of cases because of that.
Absolutely. Now, Dr. Reddy, you are based out of Hyderabad. Now, this survey was specific to Delhi, but what are the lessons that other cities can learn, for instance, Hyderabad or Mumbai or Chennai, from the lessons that we've learned from the serological survey conducted in Delhi?
Yeah, one important lesson I think we have learned is the number of asymptomatic patients.
Right.
They infected but did not develop illness is significantly high. I mean, it's a good news that a lot of people don't develop illness. It also tells us the true rate of infection. So it is important for most of the cities or even the towns to have the surveillance study to calibrate their response as per the current prevalence of infection. The second important information I can gather is in the next 4 weeks, now it has already passed, what could have been the infection rate if we do the surveillance today? And because that tells us how close we are moving towards the herd immunity level, which for the COVID virus, at its reproduction rate of 2.8, is expected to be around 64% of the population. So these are the two important information that we can gather as to what percentage of infected people are truly asymptomatic. For example, in Spain, the asymptomatic to the positive cases ratio was 10:1. As for a similar study across the country, actually, not just in one city. The Delhi numbers, if we extrapolate to the Delhi population, it translates to almost 100 asymptomatic cases for every positive case. So that's very interesting to analyze. I think what are the factors which are making us truly asymptomatic? Similarly, the mortality rate has been much lower compared to many other countries. So there may be, in addition to the public health measures which the government has been taking and the people's cooperation in some of the social distancing, what could be the other reasons in terms of the BCG vaccination or innate immunity? What is actually making people the lesser mortality as well as large number of people remaining asymptomatic despite infection? So I think the NCDC must be looking much deeper into the study to have much more learnings which can be applied in the public health measures.
Right. Dr. Guleria, correct me if I'm wrong, but the Delhi survey, we are told that it will help formulate an alternative strategy if required going forward, not only in Delhi but elsewhere in the country as well. Help us understand the import of the results from this survey and how they can go towards formulating a strategy or a new strategy if required going forward.
So there are two things. One is for Delhi and the other is for other cities which have a similar population density.
Right.
What it does suggest is that, as has already been mentioned, that a large number of our population does have exposure and have asymptomatic illness, and it is a good sign. It also tells us that we have a much lower mortality than what was being shown in the West. And one of the theories could also be that we are a younger population. The average age of our population is much younger, and we know that younger people have milder illness and thereby the mortality is lower. It also helps us to look at how things are changing, what strategy do we need in terms of further planning. For example, if this number was high, we would have said that we've reached a stage where there is a large scale transmission occurring and we need to change our strategy.
Right.
Currently, as we are saying, 77% of people are still vulnerable. So I think the initial strategy or the strategy that we have currently in terms of social distancing, in terms of isolation, in terms of testing, tracing and isolating, we need to continue aggressively because we need to continue with the progress that we've made. The number of cases in Delhi have come down significantly. But this survey tells us that we need to work more in terms of keeping that level down, both in terms of mortality and number of cases.
Dr. Reddy, now this survey was specific to Delhi, but if I were to ask you, would you recommend or favor similar tests elsewhere in the country? Is it practical? Is it feasible? Or you think one can draw the lessons from Delhi survey and replicate it going forward elsewhere?
No, in fact, it has to be replicated in every city and even I think the towns, as the epidemic spreads to the towns, it has to be replicated there in a sampling basis, I mean, statistical sampling basis to understand how the infection is spreading and how the population is behaving. So this is a strong lesson actually that what we thought or the case load